Did you know that pancreatic cancer is one of the deadliest cancers because it often goes unnoticed until it's too late? Ladies, this is your wake-up call. Pancreatic cancer is known for its silent and aggressive nature, often leaving little room for early intervention. While most of us have heard of breast or ovarian cancer, pancreatic cancer is just as important to understand, especially since it often doesn't show symptoms until it has already spread. And unfortunately, by the time it's detected, it's often in the late stages when treatment options are limited. Why does this matter to women? Because pancreatic cancer can affect anyone, but women, especially those over 45, are at a higher risk. In fact, according to the American Cancer Society, over 64,000 people in the US will be diagnosed with pancreatic cancer this year alone. And what's even more alarming is that, despite its high mortality rate, early detection can make a significant difference in survival rates. Recognizing the symptoms early could be the difference between life and death, which is why it's crucial to pay attention to the signs your body might be giving you. In today's video, we'll walk you through 10 critical warning signs of pancreatic cancer. Some of these symptoms might seem minor or like everyday discomforts, but ignoring them could cost you your life. From persistent abdominal pain to unexplained weight loss, the signs can vary, and being aware of them is essential for timely action. So, I encourage you to stick around until the end, because not only will you learn what these signs are, but we'll also share actionable steps you can take to protect yourself and how to support a loved one who might be battling this disease. Don't go anywhere. This information could save a life, and that life could be yours. Pancreatic cancer begins in the pancreas, a small but vital organ located behind your stomach. The pancreas plays a crucial role in digestion by producing enzymes that help break down food and regulate blood sugar levels through the production of insulin. When cancer develops in this organ, it often starts silently, growing without causing obvious symptoms until it has already spread to other parts of the body. This makes pancreatic cancer particularly difficult to detect in its early stages, contributing to its reputation as the silent killer. In the early stages, pancreatic cancer is often asymptomatic, which means many people don't notice anything unusual until the disease has progressed significantly. According to research, only about 10% of pancreatic cancer cases are diagnosed early enough to benefit from the most effective treatments. This alarming statistic is why awareness of the symptoms is so crucial. It can make all the difference in improving survival rates. So, who is most at risk? While pancreatic cancer can affect anyone, certain factors can increase the likelihood of developing the disease. Women over the age of 45 are at a higher risk, particularly those with a family history of cancer or genetic mutations that make them more susceptible. Conditions like diabetes or chronic pancreatitis, long-term inflammation of the pancreas, also increase the risk. Additionally, lifestyle factors such as smoking and obesity are major contributors. Studies have shown that people who smoke have a higher chance of developing pancreatic cancer, as do those with unhealthy eating habits or sedentary lifestyles. Now that we understand what pancreatic cancer is and who is most at risk, let's dive into the symptoms you need to watch out for. Recognizing even one of these signs early can be life-saving, so stay tuned as we explore the warning signs that could help you spot this deadly disease before it's too late. 10 symptoms of pancreatic cancer. Pancreatic cancer is notoriously difficult to diagnose early because its symptoms often resemble those of other, less serious conditions. However, recognizing these symptoms early on can help you take the crucial step of consulting a doctor, which could potentially save your life. Let's dive into the 10 symptoms of pancreatic cancer that you should be aware of. Symptom 1. Persistent abdominal pain. Abdominal pain is one of the most common symptoms of pancreatic cancer. It's often described as a dull ache or sharp pain that can radiate to the back. The pain tends to worsen after eating, and you may feel discomfort even when you're not moving. Many people mistake this symptom for indigestion or a stomach ulcer, but if the pain becomes persistent or more intense over time, it's essential to take notice. Studies show that around 70% of pancreatic cancer patients report experiencing abdominal pain, which is often overlooked in the early stages. Symptom 2. Sudden weight loss. Without trying, unexplained weight loss is another key symptom of pancreatic cancer. This often occurs due to malabsorption, where the body is unable to properly digest and absorb nutrients because the cancer interferes with normal digestive processes. In fact, rapid and unintentional weight loss occurs in about 80% of pancreatic cancer patients. You may also notice that you feel hungrier but still lose weight as your body is not absorbing nutrients efficiently. Symptom 3. Jaundice, yellowing skin and eyes. Jaundice, the yellowing of the skin and eyes, can occur when pancreatic cancer blocks the bile ducts. The bile, which helps in digesting fats, backs up into the bloodstream, causing a yellowish tint to the skin and whites of the eyes. Jaundice is one of the earliest visible signs of pancreatic cancer and is seen in over 50% of patients. It's a critical symptom to watch for, as it can indicate that the cancer is affecting the liver or bile ducts. Symptom 4. Changes in stool. Changes in stool can also be an indicator of pancreatic cancer. When the pancreas is not functioning properly, it affects digestion, leading to pale, greasy, or foul-smelling stools. These stools may float in the toilet due to the fat content that your body is unable to digest properly. This can be a subtle but important warning sign that something is wrong. Symptom 5. New-onset diabetes. Pancreatic cancer can disrupt the pancreas's ability to produce insulin, leading to diabetes. While diabetes is a common condition, when it develops suddenly in an otherwise healthy individual, it may be a sign of pancreatic cancer. Studies show that up to 40% of pancreatic cancer patients develop diabetes before being diagnosed, sometimes years before the cancer is detected. Symptom 6. Fatigue that won't go away. Feeling fatigued or exhausted is a common complaint, but if the fatigue feels disproportionate to your normal activity levels and doesn't go away with rest, it could be a warning sign of pancreatic cancer. Cancer cells require a significant amount of energy, often diverting it from the body's normal functions, leaving you feeling drained. This kind of fatigue is different from regular tiredness. It's constant and doesn't improve with sleep. Symptom 7. Loss of appetite. A sudden loss of appetite, particularly if you find yourself uninterested in your favorite foods, can be another alarming symptom of pancreatic cancer. This can occur because the cancer disrupts your body's normal metabolic functions and affects how you feel about food. The loss of appetite often leads to further weight loss and malnutrition, making it even harder for your body to fight the disease. If you experience a noticeable decrease in your appetite for no apparent reason, and it leads to weight loss, don't wait. Seek medical advice to rule out serious conditions like pancreatic cancer. Symptom 8. Nausea and vomiting. Persistent nausea and vomiting can occur due to the tumor's growth, which may press against the stomach or intestines, interfering with normal digestion. As the tumor blocks the normal flow of food through the digestive system, you may feel nauseous or even vomit, especially after meals. This is a clear sign that something is disrupting the digestive process. Symptom 9. Blood clots. Blood clots are an often overlooked symptom of pancreatic cancer. The body's response to cancer can increase the risk of clotting, and up to 15% of pancreatic cancer patients report blood clots as one of their first symptoms. These clots can appear in various parts of the body, such as the legs, deep vein thrombosis, or even in the lungs, pulmonary embolism. Symptom 10. Depression and mood changes. Mood changes, including unexplained depression or mood swings, can sometimes precede the diagnosis of pancreatic cancer. This happens due to changes in brain chemistry caused by the cancer itself or by the body's response to it. Recent studies have found that mood changes can occur months before a diagnosis is made, which is why it's important not to dismiss these emotional changes as just stress or anxiety. What to do if you notice these symptoms? If you've noticed any of the symptoms we discussed, whether it's persistent abdominal pain, sudden weight loss, jaundice, or any of the other signs, it's important not to panic, but also not to ignore them. Pancreatic cancer is a silent killer precisely because it often goes undetected in its early stages. So recognizing these symptoms early can make a huge difference. The key takeaway here is to take immediate action. Early detection of pancreatic cancer greatly increases the chances of effective treatment. Emphasize the importance of early action. It's crucial to remember that early detection of pancreatic cancer can be the difference between life and death. The earlier the cancer is caught, the more options you have for treatment. Many people don't experience symptoms until the cancer has already spread, making early diagnosis a challenge. However, if you notice any of these symptoms, you should not wait for them to go away on their own. The faster you act, the more likely you are to catch the disease in its early stages. This doesn't mean you should jump to conclusions or assume the worst, but it's always better to be cautious when it comes to your health. If you notice any changes in your body that aren't typical for you, it's worth getting them checked out. Even if it turns out to be something less serious, it's always better to know for sure than to ignore potential signs of something more dangerous. Encourage medical evaluation. Seeing a doctor for a detailed examination is the next step. A doctor can conduct a thorough assessment, starting with a review of your medical history and a physical examination. Based on your symptoms, they may order blood tests to check for markers commonly elevated in pancreatic cancer, such as CA19-9. Imaging tests, like a CT scan, ultrasound, or MRI, can help doctors visualize the pancreas and surrounding areas, allowing them to spot any tumors or abnormalities. Additionally, in some cases, a biopsy may be needed to confirm whether cancer cells are present. Don't be afraid to ask for the tests you think are necessary, and if you feel your concerns aren't being taken seriously, don't hesitate to seek a second opinion. Early diagnosis is the key, and getting the right tests as soon as possible can improve your chances for a successful treatment plan. Empower with knowledge. It's also important to understand that while these symptoms can be linked to pancreatic cancer, they can also indicate other health issues that require medical attention. For example, unexplained weight loss or loss of appetite might be signs of other gastrointestinal problems, such as ulcers, gallstones, or liver disease. Abdominal pain can also be caused by a variety of conditions, including gastritis, reflux, or even a food intolerance. In many cases, the symptoms of pancreatic cancer are similar to those of less severe conditions. However, Getting them checked out ensures that if something more serious is happening, it's addressed as soon as possible. Even if it's not pancreatic cancer, seeking medical evaluation is crucial for your overall well-being. Symptoms that are left unchecked can worsen over time, leading to more complicated health issues. By taking action now, you're being proactive about your health and ensuring you're getting the right treatment, no matter the diagnosis. Pancreatic cancer doesn't have to be a death sentence if caught early. Knowledge is power, and now you have the tools to protect yourself and your loved ones. Remember, recognizing the symptoms and seeking early medical attention can make all the difference in the world. Help us raise awareness by sharing this video with someone who might need it. And if you found this helpful, don't forget to like and subscribe for more life-saving content. Stay tuned for our upcoming video on foods that may reduce your risk of cancer. Your health matters.